if you're able to develop a program as we've outlined it here at Leahy, where you have standardized reporting of CT scans and a true devoted multidisciplinary team to lung cancer screening, the outcomes are excellent.
Through a multidisciplinary approach, we bring them from abnormal CT, diagnosis, and into treatment in a very efficient manner.
The LungRad system helps sort of curtail some of the influx of patients that would be inappropriate for specialty follow-up. A patient who has a small nodule identified that is probably benign is not going to end up with specialty pulmonology follow-up or thoracic surgery follow-up. They're not going to go for unnecessary biopsies or unnecessary surgery. This process relies upon properly trained radiologists. It's not simply that you can start using a LungRad system without any kind of training. Our radiologists go through a rigorous process to train for this.
Our rate of intervention on benign disease is about 0.3% versus 0.6%, which is in the NLST, demonstrating that we really are not intervening in patients unnecessarily. We really have we think, a very low rate of surgical interventions in patients who don't need surgical intervention.
I will tell you that as a surgeon, when we get these reports, it makes a huge difference. We can actually objectively understand what is being seen on the CT scan. There's very little editorializing. This language is consistent and standardized.
Well, the hurdles that we face the most in lung cancer screening is educating not only the patient but the referring physicians, but also in dealing with the insurance companies. As you know, lung cancer screening was not approved until 2015 for high-risk patients, and those are Medicare patients. But we see a large percentage of patients who are not in that grouping of potential lung cancers. So just educating the other patients who have at moderate risk. But it's going to and educating the insurance companies about who should be screened, what is the reimbursement, and so forth. So it really deals with our billing office also in getting that done.
We're victims of the stigma when it comes to lung cancer. We think lung cancer is something that only happens to people who smoke. Lung cancer does not discriminate. Many people get lung cancer who've never smoked. And I think lung cancer screening offers hope to the physicians for the patients who are at risk, but also to me, it gives me a satisfaction in knowing that I can help break down the walls and get rid of the stigma associated with it. If more people would know the facts about lung cancer, I think that we would have more people, we'd have more lives saved through screening.
Patients have a lot of fear, and we commonly encounter patients who have been referred for lung cancer screening, but perhaps they're just nervous to go get that scan. They don't really want to know. That's a hurdle that we address by education. We address it by giving talks to the community and community outreach.